All right, hi everyone. Thanks for joining us. Dr. Mario Elia here. I'm going to do a series of videos that my hope is that it helps family physicians with catching up on some of the things that we may have fallen behind on with COVID, and using kind of the next 2 months, July, August, into September, before we hit that second wave of things that we can catch up in our practices. So I'm going to show you some videos based on the PS Suite EMR with some searches and reminders that I've created that can help you to optimize these things. Okay, so the first video we're going to do today is all about vaccinations. So show you some of the searches here. And we'll start with the pneumococcal vaccine. So I'll show you the reminder that we've set up here on our system. So in our system, I've labeled them all as our London Lambeth Family Health Organization and under immunizations. Now these files will all be shareable. I'm still working on exactly where we're going to house them, but in the link in the YouTube video, I'll include exactly what website to find them in. Okay, so for all of these files. So we're going to start with Pneumovax. So we've created a reminder here so that any patient who has had fewer than one Pneumovax and is either 65 or over, and you can see here we've actually included all of the chronic disease codes that correspond to the Ontario guidelines for who would actually be eligible for Pneumovax. So you can see some of them here, 250 being your diabetes, 410 through 415 are coronary artery disease, we've got 428 for heart failure in there. So you can see we've got a whole bunch of these codes. We've got a Hep B and Hep C code in there, COPD. Now we've got asthma in there, and I'll clarify that in just a second. So again, we've just got all the codes here. Not only we'll capture those who are due for one dose of Pneumovax, but it shows the people here who are also eligible for 2 doses. So that being people who are immunosuppressed, those with chronic kidney disease, and again, we'll clarify that in a second as well, or those who are on immunosuppressants. So we've included all of those immunosuppressants here as well for you guys to make things easy. Okay, so just a quick clarification around asthma and chronic kidney disease. So I've included here asthma, one of the criteria, but as you'll know, not every patient with asthma is eligible for a Pneumovax. They need to be on high-dose steroids. So for whatever reason, for your asthma patients, if it shows up that they're due and you think they're not due, you can always double-click the reminder and say inappropriate. But we've included, we're being a little liberal here with the reminder. Okay. The other area is chronic kidney disease. So again, the guidelines would say that anyone with chronic renal failure would be eligible for 2 Pneumovax doses. Again, you have to use your discretion. I know in my practice, I've deemed that anyone with a GFR less than 45 to have sufficient renal function to be eligible for this. They don't actually specify in the guidelines, and it's difficult to find any specifics around this. So again, anyone with chronic kidney disease who is labeled as that in your chart, this reminder will pop up for them. But again, if you don't feel that it's appropriate, if you think their renal function is too good to be eligible for this, don't hesitate just to double click in their chart as being inappropriate. And actually, I'll show you that quickly here. For any reminder here, if it says they're due for something and you think it's inappropriate, you would just double click and say inappropriate, and you would say why. So not on high dose steroids or whatever you think would be the rationale, and you would see here on the side, it would then say inappropriate. Okay, so we'll go back to those reminders. So again, for Pneumovax, those are the criteria we used. Okay, now let's say you're trying to clean up your data, you're wanting to reach out to these patients. What do? Well, we create a reminder report. So patient reminder report, and we scroll down to the one we want to find. So it's LFO Immunizations Pneumovax, and we uncheck all the doctors, and you just check whichever physicians you want. You can do a multiple physicians if you want, but let's just say I want to find my own patients, and I would click reminders. Okay, what this does then is it brings up a new window with the list of all of your patients who are eligible, who meet the criteria. Okay, I'm not going to do it just for privacy reasons, but that's how you would do that for the Pneumovax. Okay, we'll show you a few others. So I know most of you have been keeping up on your well baby immunizations, but if you think you've fallen behind, we've got a few of them that could help you. So we've got one here called Pediacel. So that's if they're 2 months or over and have had less than one dose of the components of the Pediacel, or if they're 4 months or over and have had fewer than 2 doses of the components of the Pediacel, or if they're 6 months or over and have had fewer than 3 components of the Pediacel, or if they're 18 months or over and have had fewer than 4 components of the Pediacel. Okay. The other criteria I've added here is if they're under 4. The reason for that is I have a different reminder I'll show you in a second for adacel-polio, which will capture those patients. Okay, so you would run that list. That would show you the people who are due for that vaccination. The other one would be Prevnar child. So if they are 2 months or over and have had fewer than 1 dose of Prevnar, 4 months or over and have had fewer than 2 doses of Prevnar, 12 months or over and have had fewer than 3 doses of Prevnar, and if they're all under 4 years of age, that'll show them. And lastly, we've got the Rotarix here, so the Rotatech. So now that Rotatech's been around for long enough, this will work for all of them. When there was both Rotarix and Rotatech out there, this was a bit trickier. Now, for whatever reason you're still using Rotarix, you'll have to adjust this, but this is a Rotatech reminder. So if they're two months of age or over and have had fewer than 1 dose, 4 months of age or over and fewer than 2 doses, or if they're over 6 months of age or over and have had fewer than 3 doses, it'll trigger this reminder. And again, they have to be 8 months of age or younger, because once they're 9 months, they're not eligible. So you can run that reminder as well. Other ones for kids will be the MMR. So we've got two components of this MMR. So if they're 12 months or age or over and have had fewer than 1 dose of each of the components of the MMR and they're under 4, or if they're between 4 and 18 years of age and have had fewer than 2 doses, that will also trigger this. Okay, so another one around the 12-month mark is your meningococcal. So if they're between 12 months of age and 4 years of age and they've had fewer than 1 meningococcal, it'll trigger this. And the last one for the early childhood vaccines would be Varivax. So I'll show you what I've done for this. So if they're between 15 months of age and 4 years of age and they've had fewer than 1 dose of varicella, it will trigger. Or if they've had, if they're between 4 years of age, or if they're over 4 years of age, and their birth date is later than December 31st, 1996. So I'll explain why I've done this. You'll know from the guidelines, it'll say anyone born in 2000 or later would be eligible. I've found that kids born between 97 and 2000, with that kind of area where the vaccine was just being implemented, I found that I found a few kids who haven't had the varicella vaccine, but have also not had chickenpox. There's been a non-insignificant number of those. So I've included it going all the way back to 97 if they've had fewer than two doses. But for those patients who are, born in that kind of late 90s, early 2000s age group, before we even invite them to be vaccinated, we ask their parents whether they whether they remember having had chickenpox, and if they do, we just update the reminder that it's inappropriate. Okay, so again, this does create a bit of a longer list, but we found that to be quite helpful. All right, a few other ones that I can show you. These are the grade 7. So one other one, adacel-polio, we can show you here too. So if they're between 4 years and 13 years of age, and they've had fewer than 5 doses of the components of the adacel-polio, that'll trigger this reminder. So again, I'll show you here, you would just click reminders, and that would give you the report of the kids who are due for those. Okay, now we'll talk about the grade 7 ones quickly here. So as most of you know, kids in grade 7 did not get their second dose. Many kids did not get their second dose of their Hep B and Gardasil 9 vaccines. And depending on the jurisdiction, that's either fallen to the family physicians, pediatricians, or they're being encouraged to go to the health unit. And in some cases, they're going to be doing it in the fall. But for those of you who want to kind of get on top of things, these are a few reminders that you can use. So we'll do this one first. So this is Gardasil. So for patients who've had fewer than 2 doses of HPV, and if they're male and born between December 31st, 2004 and January 1st, 2008, or if they're female and born between those dates, the reason is that females who are eligible all the way up until grade 12 because they've been eligible the whole time. Males are only eligible as of a certain period of time. They haven't been eligible as long, so that's why I changed the dates here. So these dates are accurate for the 2019-2020 school year. Okay, as we get into the 2020-2021 school year, we'll be changing these, but these are accurate as per now and to be used for this coming 2020 summer. Okay, for those of you who are using Health Equity custom vitals, we have a vital called sexual orientation that we've used. I'll show that in another video. But if we've labeled them as being gay and under age 25, of course, these patients are also eligible for the Gardasil, so we've included them in this as well. Okay, another one. So Hep B, if they've had fewer than 2 doses of Hep B, and born between December 31st, 2001 and January 1st, 2008, they are eligible for the Hep B this year. And the last one is the Menactra. Okay, so if they've had fewer than 1 Menactra dose and are born between the same dates as the Hep B, or I've actually included here the ICD codes for those who've had a splenectomy or hyposplenic. Those are those codes here. If they've had any of those and it's been over 5 years since their last meningococcal polysaccharide vaccine, they will also trigger. Okay, so we've got a few useful ones here. Some of them you may want to use, some of them you may not want to use. Again, I will be including the links to where we're going to house these reminders so you can simply upload them to your system. But we found them quite interesting to use in our practice. And hopefully you guys find them useful too. Of course, give me any feedback you have. I'll include my email in the address. Thanks for watching.